behalf of COVID Academic Research Consortium, or ARC, led by Dean Ronald Mendoza, we welcome you to the first series of webinar on international best practices on the fight against COVID-19. Diseases know no geographical or geopolitical boundaries, and hence solutions for health should also bear no boundaries. Taiwan to date has 58,000 persons for testing and for COVID testing, with confirmed cases of 427. Cases are largely imported, and there is no local community outbreak. Case fatality also has been relatively low. Today, we bring you a unique opportunity to learn lessons from Taiwan. What makes them unique in their approach to facing an adversary like SARS-2 coronavirus? What can we adopt by way of strategy, governance, and risk communication anchored on scientific principles? We hope that today, the insights I am Kenneth Hardigan Go from the Asian Institute of Management, Zulik School of Development Management, and coming from the COVID Situation Room, together with our academic partners, Ateneo University, namely the 4 professional schools, Ateneo School of Medicine and Public Health, Ateneo School of Law, Ateneo School of Government, and the Ateneo Graduate School of Business, or John Go Kongwei School of Management, as well as the De La Salle University Jesse Robredo Institute of Government. We welcome you today to this online forum. But first, let me introduce you to our 2 esteemed speakers from Taiwan. I'd like to introduce Dr. Mei Sang Ho. Apart from being the president of the Taiwan Health Corporation, Dr. Ho is a member of the Vaccine and Related Biologic Products Advisory Committee for the Center for Drug Evaluation in Taiwan, and also the Task Force for Pandemic Influenza Preparedness in Taiwan. She is a licensed physician in Taiwan, Massachusetts, and California, and having received a contribution award for SARS control by the Executive Yuan of Taiwan in 2003. The second speaker we have is Ambassador Tai-Chu Chow. Ambassador Chow is currently the spokesperson for the Taipei city government and who has a respected diplomatic career. Remembered for serving with generosity, warmth, and caring spirit, he is served as an ambassador at the Taipei Resident Office of Netherlands and an ambassador of Embassy of the Republic of China in St. Lucia. After the 2 talks, we bring in Mr. Christian Esquera, a multi-talented media professional and an academic in the field of journalism education, with career experience ranging from print to broadcast. He will be our moderator for the program's Q&A with our 2 Taiwanese resource speakers. I will be remiss if I don't thank the following institution. We'd like to thank and acknowledge our media partners this afternoon and thanking them for this coverage. We'd like to thank V81 Radio Worldwide. This is a radio station broadcasting this via live stream. Talkshop Asia Program and Communities. DZXL588 Usaping Trabaho of Mr. Ramsey Tirona. Last but not least, we have ABS-CBN to thank Mr. Willard Cheng. And finally, we thank Taiwan Economic Cultural Office in Manila for their ardent coordination to make this seminar happen. Let us therefore welcome our first speaker, Dr. Mei Sang Ho. Dr. Ho, you have the floor.
Okay. Let me put on my slides first. Good afternoon, ladies and gentlemen. Mei Sang Ho speaking from Taipei. It's really my great pleasure to share with you our experiences. My outlines, the talk of my outline are as such. I will give a few slides on the pandemic overview. Then I would talk about the 4 layers of protection. That will be a lot of our practices and scientific backgrounds of that. And whenever applicable, I will share with you our Taiwanese practices. Then finally, I would talk about the preparedness for a long battle or for the next wave. First, the overview of the COVID-19 pandemic. With the past few months of ongoing spread of the disease throughout the world, we all have come to the understanding and accept the fact that this disease is not going to be eradicated by our current available control measures. And in the meantime, with its rapid transmission rate, often would render the patient number that exceeds healthcare capacity in many countries in such a way that some of the very drastic measures would have to be implemented, such as total national or at the local level lockdown of the whole activity. As we know that would result in the disruption of what we call normal life, that would halt the economical growth. And for some people, actually quite a big proportion of the people, their life have always already been at the margin that's really life-threatening for them. And such kind of damaging effect has really spared no nations. So let me share with you what the Taiwanese government has done. They have, of course, put up some monies to compensate the hard-hit businesses. So the amount of money has been going up and up. So I kind of lost track of how it would be, because there seems to be no cap to that. And they provide subsidy to healthcare workers, quarantine citizens, etc., and even to healthcare system. And also they implement delay payments like taxes and rent, especially to the governmental facilities. Also, there are state guaranteed loans for the individuals or for the industry. And there are also alternative means to boost the local travel industry, such as solicit motels, hotels to serve as quarantine facility. So because at this moment we've implemented quarantine policy for those inbound travelers. At the height of the count, we had 50,000 individuals were under quarantine, and many of them would have to use the hotel facility. So that's another way to boost a very much sort of devastated industry. Often I'm asked the question, when would the pandemic end? It's a difficult question to ask, but technically we would say that when sufficient proportion of the population possess immunity, the transmission of the disease will be slowed down or will be halted. So what does that mean? This graph illustrates that for a new disease, initially 100% of the population is susceptible to the disease. As the virus, as the infection is spread through the population, the susceptible will decrease as represented by the black line, and the resistant population, such as those who have been infected and hopefully immune to the infection, would increase. So at some point in time, they would cross, and at some point in time, this is something we call herd immunity that would halt the transmission. But as you know that we ask where we are, when will we get there? We are about at the beginning. So how do I know we are about the beginning? Because there are information just published. I just grabbed this. Even without this information, you can guess it's very low. But the highest proportion of the infected will be at some local area where that's really hard hit, like New York State, that's 14%, New York City, 21%, showing these people with antibody. Hopefully they are protective antibodies. And also in a small town in Germany, that's at the border between Germany and Netherlands, that was also a very hard hit town, that 14% of the inhabitants showed the antibody. But aside from that, when you do a general screen, that's about 2 to 3% in these areas, that's in this country. So we know that we are not going to, we are right here, and it will be really a long way before we reach somewhere we call we are home free. So we know that without vaccine or effective antiviral drugs, the proceed of this infection among the population would be made very slow, as I just illustrated to you. That's how we have been doing that. So now, so with this background, I will end with a note that we have to be prepared for a long-lasting pandemic, long-lasting, because we always compare COVID-19 with SARS. SARS ended within a few months and then it disappeared totally. Here, COVID-19 is a different animal. It does different things. We have to think differently. So now we come to the outline of protection. Here we call 4 layers. This is the way I put it from an individual point of view. At the first stage, first level will be border control. This is applicable to all nations outside of China initially, because the virus can be imported through the infected travelers from the epidemic area. So if you control your border, you will block the virus entry. At the second level would be if the virus enters the population, then still at the individual level, each one practices social distances, their hand hygiene, their wearing facial masks when appropriate in a crowded area. That would reduce the possibility of exposure, thus reduce the risk of infection. Of course, there are lots of logistics that at the society level that will make individual to be compliant to such practices a little easier, such as contact tracing, quarantine, digital tracking, and also financial support and social and mental support, etc. I will come back to this just a little bit. And the third layer of protection, you see, is sort of, it's not there, but because it's really talked about. Today, I would like to discuss with you that the third layer is something about individual health status that would determine a person, once he or she acquires the disease, would end up with very severe disease or end up with asymptomatic state. So that's a lot to do with lifestyle. I will come back to that later. And then finally, that will be the fourth layer of protection. For the small percentage of the individual who requires hospitalization, in total, maybe less than 20% really need hospital care, and maybe less than 5%, more like 3 or 4% will require more intensive care. And in such case, that healthcare facility had better be ready to serve them so that they can recover from their illnesses. So come back to the severity spectrum, because from the clinical data, we know what are the risk factors for severe or fatal cases of COVID-19. These are the individuals with diabetes, cardiovascular disease, hypertension, chronic respiratory illnesses, obesity, and older age. So we know, so these are the factors. And then also from the seroepidemiological study or other studies, we know that a large proportion of the infected people are asymptomatic. For instance, in Diamond Princess, the cruise ship, it shows 40 to 50% of the confirmed cases were asymptomatic. In Iceland, they did population screening showing that 50% of the confirmed cases are also asymptomatic. The Japanese returned from Wuhan and showing 30% of the asymptomatic. And in New York City, this is something sort of showing that pregnant women, when they did a screening, they found only 30 out of 215 showing symptoms. So that's a very high percentage of asymptomatic infection. So one would ask, what determines this asymptomatic outcome and what determines this very severe outcome? When we looked at this high risk, this higher risk population, and what makes these diseases to be to be so severe, we know it's a lot to do with lifestyle. So this is to illustrate in a more graphic way that personal behavior may reduce the exposure probability and infection probability, and other host metabolic state or health state would determine whether they would have severe or asymptomatic cases. When we looked at this metabolic state, we know a lot of these are modifiable by lifestyles on a long-term basis. So we begin to think that at this time in age, when we deal with COVID-19, while we have no vaccine, we have no effective drug, what are the ways to reduce the risk for having the severe diseases? This is something we should explore it more seriously, because that's one of the few areas that's modifiable within our personal capacity. Then I would like to take this point a little further to look at the individual case. When an infected person, when they are exposed during the incubation period and then they develop symptoms, usually the first week of symptom, they are very much they present mostly very mild symptoms such as upper airway infection. And then small percentage of these infected people would go on to develop severe diseases. When does the deviation take part? Usually between 7th and 10th day. Those who would go on develop severe diseases would develop respiratory distress or begin at this time. So one would think that before that, is there something modifiable? There's anecdotal observation of young students returning abroad because they are traveling, the hectic of traveling, and try to secure a flight, a ticket to get home, and during the process, it may be days before they get home, they don't eat well. And when they arrive, they seem to be okay, a mild case, but then they will quickly develop very severe symptoms and go downhill. So these are anecdotal observations by the clinicians, and thinking perhaps that's the time the stress, the poor nutrition, etc., make they are unable to fight against the infection, and their lymphocytes become really low at that time. So this is again something for us to think about, whether we would modify our nutritional intervention for this infected individual. Then I come back to the border control. So in Taiwan, our method is to keep the viruses outside of our homeland. Now here I started with January 1st, but there's a lot of activity before that. I would like to point out to you that Taiwan Experience is an example of deviation from WHO recommendation, because we have had to do our own thing, because we have about 1 million Taiwanese people working in China at that time, knowing that they would return to Taiwan to join us for the Chinese festival. So at that time, we were watching very closely. There were activities before 2019, but our first case arrived on the January 20th. A 50-year-old female working in Wuhan. She had disease onset on the 10th of January. She waited 10 days. She didn't go to any hospital. She didn't want to go to any hospital. Finally returned home on the 20th. She was confirmed as of our first case on the 21st. She exposed her risk factors to be nothing, because she said she had not been to Huanan market. She had not been to hospital or healthcare facility. She had not been in contact with anybody with upper respiratory symptoms. So we know that this is a case, what we call a case without infection source. And for a newly emerged disease to have no source, meaning it's a community acquired disease. This, although only one case, that makes us very much alert. So immediately, our government had a lot of doings like ban the essential travel, stop all the tour groups to and from Wuhan, and prohibit entry of the Chinese from Wuhan, etc. And also, you see, there is cancellation of international book fair. That was very, very early. This is a big event for Taiwan. Thousands of international travelers will come. The readers, the authors will come to meet their readers. It's really a very happy event, but we had to cancel that. Very painfully, we canceled that. You could see how early it was at that time. Then, of course, there are a series of travel bans and etc. So ultimately to March 18th, that all inbound travelers, regardless of nationality, would have to be quarantined for 14 days, and also a compensation of 1,000 Taiwan NT, which amounts to $35 US, is a daily compensation was given for 14 days. So that makes the quarantine is more acceptable to many people. So now we ask, because this doing has a lot to do with quarantine, then how many people to quarantine, what kind of contact to be quarantined, we ask the question, when does a patient become infectious to others? Here basically just tells you that this graph shows on this side, the blue part, these are identifiable patients because they present with symptoms. This red line shows these SARS patients, they become infectious to others after they develop symptoms. But COVID-19, they become infectious before they develop symptoms. So this is very early on, this observation was made. We put it into quantitative manner that after modeling it with international cases, it was shown that by the time a patient develops symptoms, they have reached the peak of their transmission of their infectiousness. Usually they come on such day, 3 or 4 days after their symptoms, and sometimes even much longer. So we do contact tracing and quarantine have to be done in a retrospective manner, showing that if one only isolate the sick patients, that's not going to be enough, because you're going to be missing out those people pre-symptom or without symptoms. They have been in contact with the infected individual. So we quarantine all of these people. When we go back contact tracing to find all the individuals and rate their risks and quarantine them all. That's the way we do it. Of course, this is with a lot of price for many individuals who are not infected have to be quarantined with this time. So what makes it simple or make it easier is we have digital tracking of the location. We must have sufficient number of investigation teams to do the contact tracing, to do the interview with the patient, and of course there's payment compensation. So make it more feasible with all these measures. So in the end, I just did an analysis. I say that community transmission, the risk of it is very low. How do I know that? So far, we have, our government says 10, maybe it's 10 to 12 indigenous cases with no traceable source of infection. 4 in February, 5 in March, 3 in April. The 4 in February, by the time we identify this patient, they already infected 20 people. Most of them were household members, caretakers, in the healthcare facility, so none in the community. Then in March, we have 5. By then, lots of students returned from Taiwan. So this was a roommate, asymptomatic, was only being tested by, being tested because he was a contact. He was an asymptomatic patient. Then April, we have 3 and with 1 community. This is technically is 12 plus 1 in the community. So I would say that with all this doing, our reward is a very low risk of community transmission. So how do we achieve all of this? It's a lot of trust building, such as very transparent information every morning, every day. There's public, there's a hearing, press report, and we also utilize digital platforms to counter fake news. There's lots of fake news, misinformation, disinformation, and when people are scared, you know, there are all kinds of information around, and also implement tough penalty for dissemination of these fake news. So this is something to be done. And further on the trust building of the mutual trust, give you an example. At the beginning, the surgical mask, Taiwan has a very small manufacturing capacity for surgical masks because we imported most of them. So at the very beginning, government says prohibit all the exportation. We have to keep it everything, and then government would help. Government will purchase the equipment, and there's private and public sectors and collaboration. They get the facility done, and they also have apps to allow people to look at where the masks are available, and so this is very transparent policy to distribute something. Initially was insufficient supply, but do it fairly. So create the sentiment among the population that we are all on the same boat together. So there's quite a big trust. I think I've never seen our people compliant to governmental suggestions so well. But still, we have other issues that we need to solve. Just now, I told you it's lots of activities, contact tracing, quarantine, digital tracking. Digital tracking, this is something, of course, they believe the policymakers saying we have legal ground because we do have our infectious disease code, which was revised in 2003 after SARS, so to cover some of these areas. But then also human rights issues when we do contact tracing and we tracking people wherever they are. So this is something, even though at this moment it's set to be covered and to have its legal ground and to cover by the infectious disease control code, but still we would have to revise it. We have to review it when the time comes along and to see whether it's appropriate or whether we need to do something more. And then it comes to the fourth layer, protection. Of course, this is healthcare facility where this need not to be said too much because we must have adequate supply to protect healthcare workers. We have set up outdoor triage site for potential infected patients. So we have to think of cost-efficient way to allocate our resources. I will talk about that later because in Taiwan, we have more than 1,000 negative pressure isolation room. We are using it for every confirmed COVID-19 patients goes into one of these rooms, including asymptomatic infected people. So we have to think of different ways to see whether we would use it more efficiently in the future when we have when the number has increased. And I would advise that we have to calculate our surge capacity, including human resources, etc., and have alternative plans to expand it, to plan for the worst. And all this plan has to be in advance. Now, I will talk about what's the best use of our resources. These are two publications. One shows that these are the virus load. So showing that after presentation, as I just described to you, by the time patients present with symptoms, their virus load has already come to the peak. And from then on, it drops. And also, when you looked at the development of their antibody beginning on the second week, antibodies developed, and then through the second week, all of them developed, are seroconverted with antibodies. When we looked at the nucleic acid, the virus, this is by nucleic acid testing, and this is by the culture. One sees that after the 8th day of symptom presentation, virus no longer can be cultured. For those of us in the old-time infectious disease doctor, we always knew that when one developed antibodies, the antibody coats the pathogen. So even one sheds the pathogen is no longer infectious to others. So this notion is further supported by a clinical epidemiological study showing that these are the patients in Taiwan that they had initially, they were not diagnosed as COVID patient until much later. So retrospectively, one sees that they would infect others. They are infectious only before the 5th day of the symptom onset on both these cases. Regardless of how many people they've been in contact, the infection rate is 0. So the virus load and the clinical epidemiological study sort of echo and supports each other, that probably when antibody develops, the individual is no longer infectious. So because in Taiwan, our patients goes into the negative pressure isolation room, they would be tested serially until they have 3 consecutive tests that's negative for nucleic acid, which is detected here, not by the culture. So they are detecting probably that virus, and they will go on for 20-some days. So I would think that maybe in the future we would have to switch in such thinking and try to utilize our medical facility in a more efficient manner. Then finally, I come to the prepare for the long battle. As I just now present to you that the pandemic is likely to last 4 months. So what we do, we try to slow down the transmission. At the meantime, give us the opportunity, the time to find better tools to combat the disease, such as diagnostic, better diagnostic, quicker, more accurate antiviral, so that we can treat the patients at this moment. Even before we have good drugs, the repurposing drug use, these are already licensed drug, maybe showing in vitro in the laboratory that's effective as antiviral. It's worth trying because you have nothing else to try. And then vaccine development R&D currently globally is being proceeding in an unprecedented speed. You notice that the first dose of COVID-19 vaccine was given to individuals sometime in the March, which was only 60-some days after the day the virus was identified. So this is something to be commended on, simply because a group of international people have been working together with the aim to develop vaccine against disease X. So these are imaginary sort of target, and then they set up different platforms. So now they just have to recombine different effective platforms and come up with good vaccine. So now it comes to the detection method. So far we have been identified confirmed patients with nucleic acid, which is right here. This shows the time course when this can be detected. The antigen is comes up, it would be there, but with a smaller, less sensitive. And then IgM comes up and IgG comes up. So because the pandemic will be long lasting, it's important at some point in time to determine the percent of infected people before the next wave of transmission, just in case you need to have people to donate your anti-serum, just in case you need to have people to do some more danger, more high risk tests. So these are the protected people can help you to do that. So this is my view that it should be done. Finally, I would like to end with a more hopeful and a sort of positive note that shows hope and solidarity. just in the past few days, UN General Assembly adopted the consensus of a resolution calling for equitable, efficient, and timely supply to all to any future vaccines that's developed to fight coronaviruses. So this is just to make sure that vaccine will not be available only to those countries that are rich or can afford it. So finally, I would like to say that before we all get our immunity, stay distant, eat healthy, be active, and be grateful that we are still alive. Thank you very much.
Dr. Ho, thank you very much. That indeed has been a very comprehensive and lots of scientific information that will guide our thinking process on how to deal with this difficult condition. Maybe the questions and answer will come later after the second speaker. And now I have the pleasure of welcoming Ambassador Cho. Ambassador, you have the floor now. Thank you very much.
Okay, thank you very much. I think we just heard excellent presentation by Dr. He presentation from the perspective of medical process. From my side, I would make my presentation in the administrative perspective. Before I start my presentation, I will let you know that on the 21st of April, we sent out the information of Taipei City Epidemic Prevention SOP to sister cities and cities having good connections with Taipei. Why should Taipei City share its experience? Firstly, I guess everybody could, will agree with me that COVID-19 is a very serious threat to human life and economy. Human life, you can see the number of the confirmed patients worldwide until today is more than 2.7 million. And International Monetary Fund also forecasts the Asia economic growth rate for this year should be no more than 0%. So this is has a great impact on our economy. And the virus sounds so serious. It's basically shut down many countries and cities, and the interstate traffic is interrupted. So if we want to recover our normal life, we want to enjoy our economic growth, we should work together. We are on the same boat. Regarding to Taiwan, whether if Taiwan is an excellent model or not, I guess Dr. Ho already explained very clear. In comparison to the 2.7 million confirmed patients worldwide, Taiwan today only about 427. And since Taiwan is an excellent model and Taipei play a leading role in Taiwan, so Taipei experience will be very beneficial for the foreign country. And as also mentioned by Dr. Ho, more than a quarter of confirmed cases in Taiwan that is happened in Taipei City. Very fortunately, 92% the confirmed patients they've been infected outside of Taiwan. So in our internal so-called cluster infections, which still not yet happened. I think the experience sharing and learning is very important to strengthen the capability of the world to fight against this vicious virus. Regarding to with whom Taipei City is sharing its experience, as I explained to you that we shared our experience with cities having good connections with Taipei, including the sister cities. And regarding to other cities, we put our information on our Taipei City government English website. So you can find out very easily through our website. And today, the main topic I want to introduce is the content of our Taipei Experience, we divide to four parts. First is the strategy, that will give you the comprehensive pictures how Taipei city government deal with this crisis. Regarding to the SOP, that will be in the attachment. I won't be able to explain to you in detail. The third one is the creative measures. I just give you some good examples that will inspire other cities regarding to how they should deal with this virus. And lastly, I also would like to discuss with you the advantage of Taiwan in handling this crisis. Firstly, regarding to the first part of our strategy, that is strict internal control. Strict internal control mainly aimed at preventing community infection. I just give. I think the most important work for the strict internal control, that is we have to monitor the individuals who are under the home isolation or under the home quarantine. One very creative measures by our Taipei City government is we provide a smart tracking system in cooperation with village chiefs to make sure those individuals who are under the home isolation or quarantine will stay at the hotel or their residence. And moreover, regarding to the surgical masks, that being regarded as one of the most important facilities to help to cut off the infection path of the virus. And the second strategy, we're talking about the advanced deployment. Please change. Next one. Next one. Advanced deployment, that means means second line of defense concept. Once if we won't be able to contain the virus, and then it happened to something happened to the community group infections. So this is the way we should prepare for the second phase. When we try to contain the virus, we always bear in mind that if you contain too much, that would damage our economy. So I put, we have to be very careful. Since the virus hit Taiwan, you can see a lot of business, they're going down very badly, like hotel, restaurant. I just give you an example. Hotel, five-star hotel in Taipei City. Their occupation rate, that is less than 10%. That is very serious. So we have to be very careful when the government take actions. Whether the action will have a very negative impact on our business, we should be very careful. And also we have to install more and more isolation institutions for those people need to be home isolations. When our capacity reach to 50%, normally we will start to looking for the more isolation institutions to meet the need. And also the advanced deployment also including we have to conduct some drills for mass community infections for the worst case scenario. The third one is revitalize our economy measures. I have to emphasize that the economy is as important as epidemic preventions. So I think that Dr. Ho also mentioned about government provide some relief program, and from Taipei City government side, as I explained to you that we introduced a concept called strict health management instead of prohibition. For example, the gym in Taipei City, we decide not to close down. Instead, we ask them to follow very strict regulation about hygiene, and then we still allow them to open. And then, in this way, where we will have less unemployment, and for those this kind of uh, uh, similar institutions, if you close down them, maybe 1 or 2 months they still okay, but after 3 or 6 months, they probably have to close down. When they close down, that will create a lot of social problems. And also, we also provide some economic relief measures. In our Taipei city government, our city government decide to reduce the rent by 50% for those underground install or our business circles. So that will help, those business persons. And the fourth one, that is, we try to avoid excessive mobilizations because epidemic prevention is a long-term work. It will not, as Dr. Ho explained, it will not over in just a few months. So therefore, we should not use over excessive mobilize our resource. I just give you an analogy. We should not finish all of our bullet in the first phase because more enemy may be on the way, to us. And the fifth strategy is what we are doing now. We have to do the expense sharing. Shutting down the country and cities should not last forever. And when we're doing well, like Taiwan, we're doing well, we still enjoy the freedom to travel inside of Taiwan. But we won't be able to travel to, for example, to Philippines if Philippine stores still locked. So we have to help each other to open our doors, and then we can recover the traffic between the different countries. So the success really rely on the global collaborations. And now I want to introduce the advantage of Taiwan for epidemic prevention. First is in Taiwan, we have more than 20,000 hospitals and clinics. That is the numbers even more than our convenience store. Our convenience store only about 10,000. So with so many hospitals and clinics, that will relieve the pressure for the major hospitals capabilities, and also that will also help to outreach to those potential patients. And the second, that is, we have a super national health insurance system. I guess for those people who live in the United States or the Europe, they were very impressed about this kind of system because Taiwan, most of the clinic in Taiwan, they provide a walking service. First, you don't have to wait. And second, in average, per visit only costs $5. And regarding to the quality, the satisfaction rate of our medical service is nearly 90%. So this is quite amazing. So that explains why Taiwan's medical system is one of the best 3 top medical systems in the world. And third, we had a very cooperative public, and they are willing to put on the surgical mask. Like the people who present in this room, other than me, everybody wear the surgical mask. I had a privilege because everybody put on the surgical mask, and I don't have to do so. And the last one is we had a painful SARS experience because in 2003 we suffer from this virus. We paid a very heavy price. So this explains why this time when coronavirus happened in Wuhan, China, early this year, our government took a very swift and effective measure to contain the virus. And regarding to the Taipei City's government's creative measures, I just would like to give you some examples. Firstly, I will introduce you the disease prevention taxis and ambulance. For those people who are under home quarantine or home isolations, if they need to go to hospitals, we have to provide this kind of traffic tour that will prevent they infect some other people or the other way around. Secondly, that is a quarantine hotel. Quarantine hotel is also a new concept introduced by Taipei City government because we won't be able to get so many isolation institutions in a very short period of time, and also it also costs a lot of money to build this kind of institutions. So we talked to the local hotel from the very beginning. We found difficult to invite those hotels to join to transform them from the ordinary hotel into the quarantine hotel. But nevertheless, because of the virus crisis, most of the hotel they almost run out of business, or their business go down by at least 80%. So more and more the quarantine hotel being established. For today, I think we have about 17 hotels. This is not only will help to contain the virus spreading, and also this is kind of a relief measures for because they still have income and they still can keep their person. Another concept is a family of the quarantine stay in hotel because now we have more and more people. They need to be isolation and quarantine, and only rely on these 17 hotel may not be enough. So therefore, we encourage the family of the quarantine people, the family, they stay in the hotel, and the people who need to isolation or need to quarantine, they stay at home. This in this way, that will reduce the chance for the virus being spreading. And the next one, I would introduce our public transportation system. I just give you an example of our subway system in Taipei City. I think that those companies, they had a daily disinfection on station and carriage of the subway system. Also, if they have some part of us facilities, very often people will touch. We would reinforce the disinfections for every 4 to 8 hours. And for those people who are passengers of the subway or bus or other public gathering, now according to our new law, they have to put on the surgical mask. Otherwise, if they don't abide by the regulations, they will be fined. So I think today we hold this kind of video conference. It is one of the way of the global collaborations. I'm very pleased that Dr. Go organized such kind of video conference. I do help through this platform. We can exchange our opinion. We can learn from each other, and let us to work together and get rid of the virus as soon as possible. Thank you.
Ambassador Cho, thank you very much indeed for that very clear explanation of your creative strategies and intervention, which I presume might be very helpful for us when we start planning our lifting of the lockdown or community quarantine. Uh, as I promised, after the two talks, we'll invite Mr. Christian Esquera on board to moderate our open forum where questions will be asked, and hopefully you can give us some advice, wisdom, and knowledge. Thank you, Christian. Over to you.
Hi, Dr. Ho. Thank you very much. Am I clear? Can you hear me clearly?
Yes.
Quite clearly, yes.
Thank you very much. We got a lot of questions from the participants, but first, we'd like to thank our two speakers for those information that you shared. Definitely, there's a lot to learn from the Taiwanese experience. First, someone is asking about, for example, vaccines. We receive a couple of questions regarding vaccines. Number one, is Taiwan actually developing its own vaccines? And is it also doing plasma therapy? I think this refers to the convalescent blood plasma therapy. And if I may add, what are the other treatment protocols that have shown somehow promise or actually worked when it comes to patients there in Taiwan? I think these questions should be addressed to Dr. Hall.
Okay, thank you. First of all, yes, there are several groups of vaccine developers, including two companies. They are vaccine companies. One is based on their platform of pandemic preparedness of H7N9, and the other one is the other company collaborated with US NIH to develop a vaccine. The platform is not well disclosed. Both of them are subunit vaccine, taking the spike protein and maybe even RBD or etc. And so how well it's going to go, how fast, it's anticipated that if the animal study, the hurdles of animal study is cleared. Because as you know, for vaccine development, it's very important to know the pathogenesis of the disease. Currently, the disease is so new, the virus is so new, we don't have that yet. I know that Zero in Australia is working on using their high containment level, working on non-human primate. So the best is you have to have the pathogenic model so you know what to look for when you develop the vaccine. Now, without that, how we bypass that, we are still scratching our head. So maybe information will come out and something can be quickly followed. Otherwise, if we set aside of that issue, you know, the vaccine can be developed rather quickly and probably can go into human for phase 1 trial by the year end. So that's what's in Taiwan. But I think in globally, they are probably something more advanced will proceed faster. But it's just in the end, whatever is available, the production capacity of the developer may not be enough to produce the vaccine for everybody. So how ultimately the technology can be shared is to come up with the mass amount, that's another issue. Then second of all, the question is whether we use plasma therapy. Yes, there is no well-planned clinical trial, but it's just anecdotally some doctors are using it, and the plasma is collected, and also the B cells are being isolated that might be producing good neutralizing monoclonal antibodies. So that this kind of research is also ongoing. Then thirdly, whether we have some better regimen. Oh, sadly, no, we don't have a better regimen than what's currently known. We try out all the currently known drugs like remdesivir, like hydroxychloroquine, etc., and also HIV drugs. And we don't know which one, because there's no stringent side-by-side comparison of clinical trials. So we don't know which one is better, which one works. But anecdotally, because our cure rate is rather high, I can say that, but it may not be anything to do with the drug we use.
Thank you very much for that response, Dr. Ho. Now for Ambassador Cho, some people are asking about how how Taiwan was able to manufacture so many masks such a short period. I think the question pertains to the so-called the Taiwanese mask miracle.
Well, you mean a surgical mask?
Yeah, the surgical masks.
You know, from the very beginning, as far as I know, when the officials from the Central Disease Control uh, went to China in the mid of January, they found something wrong with over there. They say so. When they returned to Taiwan, very after 1 week, we began to had so-called external control. For those people who come from Wuhan, they have to go through the check. And then at the end of January, government decided to mass productions the surgical mask. Before that time, Taiwan is the number 3 largest surgical mask production country in the world, in the capacity of roughly about 4 million per day surgical masks. And then we immediately order some surgical mask making machine from West Germany. And then as far as I know, they ship this kind of facility to Taiwan. Now Taiwan can produce roughly about 17 million surgical masks per day. Thanks to our private enterprises, they respond this crisis very fast. So this also explains why the surgical mask in Taiwan still okay.
Thank you very much for that response, Ambassador Cho. Now, this question now goes to Dr. Ho. They're asking about what percentage of the population needs to be tested for us to get a good picture or a clear picture of the extent of infection. Is there such a thing? I mean, a specific number of the population that we have to test?
No, actually, you just sample the representative. That will be enough. I think at this moment that each country have I would say that most of the countries the infection rate is very low. One can quickly look at the high population to see where they are, like the healthcare workers, like the laboratory workers, etc. If you find high percentage, then you might there might be a chance that you go to the general population. You can look at, you would stratify it by age or by sex, and you can look at the blood donor. That would be something easy to look at it. But I would imagine at this moment it's low. It will be low in most of the countries, the way we are, and especially in Philippines, it will be low.
But how accurate is that? Because some people are asking, is this already the case mortality rate when you talk about COVID-19, or the rate could still go higher if we test more?
The mortality rate would go lower if you identify more asymptomatic patients. Is that what you're asking?
Yeah.
Yeah, that's correct.
Dr. Hop, I think the concern is that there are different case fatality rates and also infection rates in different countries depending on how many actual cases they have actually detected.
Yes, that's true. Depends on the denominator. So if you have a very wide denominator with a lot of asymptomatic people, your mortality rate would be low. But I would say that initially at the beginning, usually there is a period where infection is ongoing unnoticed. In those cases, you would see higher mortality. That's our experience with SARS, and probably our experience also with COVID-19 as well. It's usually because what's the problem? Maybe the infectious dose is higher. Maybe the exposure rate is higher. I don't know. But as the epidemic goes on, the case fatality rate would drop. maybe better experience of treating patients, maybe better control measures to reduce the infection dose, something of that nature.
Okay. Now, these two questions go to Ambassador Cho. First, how did Taiwan develop mutual trust between its leaders and the citizenry? And number two, this is a question from Professor Macaranas. In view of Taiwan's current status in the community of nations, does Taiwan have a strategy of connecting to more social groups, for example, the Buddhist and education groups, rather than economic and political institutions subject to trade wars and rising power rivalry to create global public goods? And how? Ambassador.
Okay, sorry. Regarding to why our people trust our government so much, regarding to the epidemic prevention, I guess that is because government took a very early decisions. They respond to this crisis very timely. So when we take strong actions, timely reactions, so we contain the confirmed patients numbers are low. So you see, you make a every day, there's a worldwide report regarding to the confirmed cases. Taiwan, in comparison to the world numbers, the gap between bigger and bigger. Now, when the world had 2.7, we have only 427. That gives even more confidence on our people.
Okay.
I would amend. Hello?
Yeah, Dr. Ho, go ahead.
I would amend just a comment on that, because from the very early on, the public education, the message was very clear. Wash your hands, and to explain, the droplet transmission, washing hands is very important. And it's later on, then the masks become, sort of, we try to put the weighted importance of both. And also during this time, we have a lot of public advertisement, through TV, just goes on and on, show people under what circumstances to wear masks and under what circumstances you don't need it, and how to wash your hands. And I personally have been asked by several NGO groups, and including media, they try to produce educational films and ask my advice how to put it in the right context and the right perspective. So you can see it's a lot of public-private, effort to working on for the same cause. And it's for a very simple message, how to wash your hands and when to wash your hands and when to wear your mask. It's something so clear. So it becomes a practice for total population, I would say.
Okay. Dr. Ho, okay.
Regarding to the cooperation
Okay.
from our private, like religious group or some other NGO, I think currently our central government as well as the city government, we had totally confidence on our capability to deal with this crisis. Regarding to the private sectors, I guess there are several companies. They try to to find out the vaccine, whether if we can find out this kind of vaccine as soon as possible. Regarding to other group like charitable organizations, most of them at the moment they just provide some resources to help the government.
Okay. For Dr. Ho, can a person who already, let's say, conquered or defeated COVID-19, can that person still be reinfected? And someone is asking about immunization. How long will this last?
If you ask me, I would say no, there's no reinfection in a short term. we've heard a lot of media report, especially from China or Korea, saying that those people who have been discharged from hospital and then they retested at some point in time and they turn positive again, saying this is reinfection. I would think that it's just a variation of a not very accurate nucleic acid detection. In Taiwan, we have not found that, but of course our cases are very few, but also we practice it. We tested 3 times consecutive, 3 times negative before we discharge them, and we don't see anybody who turn positive again, meaning that in such case we wouldn't find any reinfection. So you asking somebody who's recovered from the infection, are they immune to the virus? I would say yes, but we don't have clear data. I would say just based on the general knowledge of infectious disease and this type of viruses, I would say yes. And you ask how long would the vaccine effect last? We don't know. That has to be tested and see.
Okay, thank you very much for that. Now, for Ambassador Cho, of course, I think this question somehow relates to the ongoing enhanced community quarantine in the Philippines. Someone is asking, has there been any military force intervention from the Taiwanese government for you to implement or to make sure that the people would follow? Have you come to that point? Or was there ever a point where that happened?
Okay, well, our case only about 427. We not even start to deploy a kind of partial shutting down city. So the military of Taiwan, we never heard about whether in the central government level or city government's level as the military to intervene to help this kind of epidemic prevention. For Taiwan, this is really unthinkable.
Okay. For Dr. Ho, this question is interesting. I think it's quite loaded. Anyway, never in history have you seen such a virulent epidemic such as COVID-19. Is this a characteristic of a man-made virus?
I agree to his first comment that this is something unprecedented, at least in our lifetime, and in the background of current technology where humans travel so fast and we have all these other technology. But the second part, if you ask me, I would say no, but there's no ground. It's just, I think to answer this question, and because so many people raise the issue, so it needs to be investigated clearly. But if I give a quick answer with my intuition, I'm looking at my understanding of this virus and its origin and this type of viruses among the bats population, I would say this is not a man-made, but it needs to be explored more stringently if people are really questioned, because me, by saying no, is not convincing anybody.
For Ambassador Cho, let's talk about the public messaging strategy by the Taiwanese government. Walk us through the planning stages and the strategies that you implemented in terms of striking that right balance in terms of making sure that people would follow. At the same time, they won't be panicking. Ambassador. Ambassador Cho?
Yeah, well, actually, firstly, regarding to the education of epidemic prevention, in Taiwan, in every city, all the corner, all the electronic screen, there appear the government, we'll try to educate our people how to protect themselves from this kind of virus. And regarding to the balance between the what is the question?
Balance between not creating panic but educating, but at the same time not creating panic.
Yeah, regarding to not creating the panic. I I really don't think so far there's any panic because of the government's the educations. Uh, but lately there was some other cities talking about they want to make a drill for the possible shutting down the city. For Taipei city government, we will make some this kind of so-called military simulation. No, no, this is kind of military simulation or tabletop exercise. We still not yet, go to the street just to make such kind of drill, because we think that that might cause some panic. Other than this, there's no any kind of action will cause the panic.
And also for Ambassador Shaw,
Yeah.
it's one of the best practices that the world has seen with Taiwan in response to this pandemic was the mobile tracking system that you had.
Yeah.
Okay. But of course, in countries such as the Philippines, this question is related to that. We might not be as efficient as far as mobile tracing is concerned. We're not even sure whether we're using it now during the outbreak here in the Philippines. So the question is has something to do with can you recommend a certain let's say certain activities or certain strategies wherein countries like the Philippines can harness digital technology so that we could do better contact tracing?
Well, this, I believe you're aware that Taiwan is an ICT very strong nation. Uh, Currently, we deploy, we depend on we put a smartphone in the house, and then we had a so-called location tracing system. So if the individual who under the home isolation or quarantine, if they leave the premises, immediately they will kick off the alarm. And also the village chief will make a phone call to the individual who under the home quarantine twice a day. In the morning, probably 7 o'clock. In the evening, also 7 o'clock, to say good morning and good evening. So make sure you are okay at home. So regarding to how to introduce this kind of experience to Philippines, I guess nowadays the smartphone is so popular. If the Philippine government need this kind of professional knowledge, I guess our government will willing to share with you how to apply this kind of device. The first, one thing is very important is that because the government, the people is they trust the government so much, so they won't be able to worry whether if their basic human right will be violated.
What do you mean, Ambassador? Can you elaborate on that?
Yeah.
Elaborate, please elaborate.
Yeah,
on that
elaborate.
statement.
Uh,
刚讲这个在讲这个
well, I think when the government try to deploy a device can trace the individual who under the certain quarantine, when you employ this kind of device, you have to first of all you have to get the confidence from the people, because the Taiwanese people fully trust the government. They believe government will not abuse this kind of device to hurt or to damage the civilian.
Okay. For Dr. A paper showed that there were patients with synchronized seroconversion of IgM and IgG while there were some having early seroconversion of IgG than IgM. Is this possible, or is it more possibly an issue on the sensitivity of the rapid kit used?
Generally, IgG follows IgM. But if you show a reverse, it's probably the non-specificity of the kit, I would say. Because the IgG, there are some sharing of different coronaviruses. So you have to use different antigen, very specific antigen to detect your antibody. Otherwise, you show cross-reactivity.
Okay.
So you might be detecting something of your previous infection of other coronavirus. That would be my guess.
Oh, thank you very much, Dr. Ho. For Ambassador Cho, what were the actions done to manage the impact of COVID-19 on the educational system there in Taiwan? Were there protocols implemented in schools to protect students and the school community while providing learning support? Basically, what were the protocols and the options provided?
Yeah. Firstly, in order to cope with this kind of virus crisis, for all the students, if before they enter into the school, they have to go through a kind of temperature measuring system to make sure whether if they have the fever or not. If they have the fever, they have to the student need to be double checked with a professional medical staff. If they make sure they are not very fit for the school, they will be sent back to their home. Secondly, there's a regulations. If one student is a confirmed patient for the for this virus, the whole class will be suspended for 2 weeks. If the two students who been identified as confirmed patients, the whole school will be suspended for 14 days. I think our regulation is very clear. That we will not just shut down or suspend the school so easily. So there's a way. Until now, in Taipei City, I think only about I think there are 1 or 2 cases. So at the moment, we are doing okay in this regard.
Okay. For Dr. Ho, what about the use of antivirals such as remdesivir and those which are used in HIV treatment? Would you recommend it as an essential component or as an essential as a treatment for COVID-19? I think we can also add to this, let's say, certain drugs. Earlier, I think during your presentation, you talked about repurposing existing drugs, for example, chloroquine and hydroxychloroquine. I would like to hear your opinion about this.
I would say that these drugs are being tested right now, and the clinical trials with early disclosure of the results with very few numbers showing conflicting information. I think there are some anecdotal observation that because these are antiviral drugs, so you need to give it early in the course. Don't wait until they have severe disease, then you try to stop the virus. So basically, if you want to maximize the efficacy of these drugs, give it early. They are antiviral, so that you stop the virus replication early in the clinical course. And I think especially for something like hydroxychloroquine, the chloroquine type drugs, these drugs affect the normal function of human cells that alters the pH of the organelle. So basically, it disrupts the normalcy of the cell, taking that mechanism to stop or slow down the virus replication. So you're thinking this way, these drugs are probably more suitable for healthy young people to help them clear the virus at early part. If you take an individual with metabolic diseases that their organs are function at 80% or whatever, you know, there are some different problems. Then you give a drug that would alter the normal function of the cells. That doesn't seem very appealing, does it? So I would say that if we want to maximize the effectiveness of this drug on a population basis, especially we want to reduce the virus shedding, the days of the virus shedding on the individuals, so maximize or minimize their days of quarantine or isolation, we treat them early.
Okay.
I think that would be that's where the effect is. From the clinical point of view, as an infectious disease doctor, we know even in the older days, we would treat the patients even fully knowing that this drug would not alter the clinical course of this patient, but we would aim to reduce the shedding of days, the days of bacterial shedding. And this would be something like Shigella, would be something like herpes virus, the sexually transmitted diseases. We would treat them, knowing fully well we would not clear the virus, but we would shorten the virus shedding, so that will make the environment more safe.
Okay, this next question I think should be answered by both of our speakers. It has something to do with the relationship between the WHO and, of course, Taiwan. It's a very interesting relationship, we know. The question is, how would you assess the performance of the WHO? And can you elaborate on how Taiwan deviated from the WHO's recommendations but led to positive results in containing the spread of the virus? What exactly was the recommendation and what exactly was the deviation? I think maybe Ambassador Cho would start.
Okay. Before that, I was the Director General for Department of International Organizations in the Ministry of Foreign Affairs. Every year, one of the most important activity is we try to re-enter or try to go to WHO to provide our medical expertise to help WHO. But it's very unfortunately, because of the political interference from China, Taiwan won't be able to even participate in WHA, that is World Health Assembly, to deliver major, message, our contributions toward this WHA. And I think that the Secretary General of WHO, that he mentioned about, Taiwan also used to participate in the so-called technical meetings. But I can tell you the truth that we submit our registrations, but I stay in that department, International Organization Department, for about 2 years. Most of the time, I think the 70 or 80% will be vetoed by WHO. So therefore, we won't be able to consistently participate even the technical meetings. For example, if last year I participated in these meetings last year, and this year they veto us without any justification. So that make us very frustrated. And frankly speaking, Taiwan is very good at medical field. I guess you know that our medical insurance system, medical system in Taiwan is one of the top 3. And then you let Taiwan out. That is a great loss for the international community. So I really think, in particularly for this kind of coronavirus 19, we are one of the top performers. Why not the WHO invite Taiwan to participate in this coming WHA meeting? I think we were impressed, with our expertise.
Dr. Hall?
Okay, the deviation comes from under the current WHO, IHR, international health regulation, where it makes recommendations as to which diseases at what stage. And from the beginning until very late stage, it always recommended that refrain yourselves from travel ban, because it was just not recommended by WHO. Taiwan, knowing full well that we have 1 million people would return from China, although these are our own people, we have to accept them, but we would reject any Chinese nationals from Wuhan at very early stage. So I think that's really an early deviation, although under IHR, any country would do anything that deviates from the recommendation, just have to report to them and explain to them why. I do not know whether our government had to do it or not, because we basically did not, or up to these days, do not have a regular communication, a communication with WHO. And besides, I was among one of the people some 20-some years ago to advocate joining WHO under observership and through WHA, and from there we could have a loose link or with a routine link with them, thinking that would be every year would be invited as a formality. The invitation would be a formality, not knowing that after we were invited for the first time, still every year this approval has to be sought before invitation was issued. This is something quite unexpected from my initial understanding from 20-some years ago to at that time, for an entity to participate, WHA as an observer requires only the invitation from the Director General of WHO. At that time, of course, there was no political interference of other country. So we began to see that something I thought in a very naive way was non-political, but indeed it was very political. So from that experience and from SARS experience, we kind of really settled down to think that we have to do our own thing and to be rely on ourselves.
Okay, I think Ambassador Cho wants to add something. I think that will be the last part of this Q&A section. Okay, go ahead, Ambassador Cho.
Okay, regarding the how do I, do I agree WHO's performance? I think the WHO when they, this is kind of coronavirus 19 is very serious, virus. You can see it caused so much damage around the world. I think they pronounced this pandemic too late. That led the whole world, reduce the time for the whole world to react this very serious virus. I think that they need to be more alert.
Okay. That note, we still have a lot of questions, but unfortunately we don't have time anymore. Thank you very much for fielding these questions. I'd like to turn you over now to Dr. Kenneth. Thank you very much.
Thank you very much, Dr. Ho and Ambassador Cho, and very much to Mr. Christian Esquera for moderating this quite interesting open forum. I'd like to offer concluding remarks to end this first series of our sessions. The key lesson for today, as I would gather, many people have said that science and politics should never come together. They should be really separated. But in situations like a COVID pandemic, the two disciplines have to consider seriously how to cooperate really for the public good. Seeking science, and lessons from Taiwan include seeking the science and accepting the possibility that this scientific information is an evolving nature, preparing for it, collaborating, gained through regular, consistent public information for the community. There are examples of private-public cooperation that were articulated by both of the speakers. Careful analysis, appropriate planning, foresight were critical elements for the success in Taiwan in fighting the COVID pandemic. Supporting science systemically for public health good seems to be quite evident in Taiwan. And as I can understand, this requires really serious and solid financial investment. Taipei City has a history of strong fundamentals. Their history of SARS experience, coupled with a very robust and strong healthcare insurance system that we can learn from, the clarity of their strategies, the creative design, the risk management approach, which in fact may come in handy for us in the Philippines should we consider lifting the community quarantine later on. I find quite interesting personally the application of technology, and this includes mobile tracking of their mobile phone GPS, which I considered a wonderful innovation. Knowing human and societal behavior, judicious investment during quarantine, and early subsidies are but some examples of nudge or behavioral economics. Avoiding a one-dimension decision making by balancing many variables of health and economics also was quite evident in this talk this afternoon. So on behalf of the academic consortium, I thank Ambassador Tom Cho, Dr. Mei Sang Ho, Christian Esquera, and the participants in this forum. I think we have something like 1,500 sign-ons to today's event, not to mention the live streaming in the radio programs. Participants, for these interesting questions that you have posed this afternoon. We have certainly learned many substantive lessons from Taiwan. We hope that you, as leaders in government, business, and community, our participants, take heed in applying the collaborative governance approach in the search for better solutions for as we bring to you lessons that can be learned from other neighboring Asian countries. Thank you very much and have a good day. Please stay healthy and safe. Bye-bye.
Your team is banning.